Happy Monday, Monday number 1 you could call it. Every Monday from now on I'm going to be sending out a video of some sort to you. Some weeks it'll be 2 minutes, maybe some up to 15, but I'll try to keep it as efficient as possible so you don't have to take too long out of your day. Today I'm talking about 3 breathing assessments you can do for yourself in hopefully about 2 minutes. So the first one is just kind of an oral history, asking yourself some questions. Do you struggle with asthma or have you previously? Do you wake up with nasal congestion or maybe a dry throat, something like that? Do you struggle with cardio? These are mostly things that I can answer yes to for the record. So just get a sense of whether breathing is something that you might benefit from working on. Number 2 is a really quick assessment. Check in on one nostril relative to the other. So you're going to close your mouth, close one side of your nose, take a few breaths there, switch sides, take a few breaths there. If you're like me, you'll feel at least a little bit of congestion at least on one side, and that doesn't mean it'll always be the same side. Maybe tomorrow you'll try again and the other side will feel congested. We'll talk more about that another time. Number 3 is a breath hold test from The Oxygen Advantage by Patrick McEwen, or however you pronounce his name correctly. Sorry, Patrick. And it's a little bit more technical, but first I just want to say, if you're on medication for blood pressure, or if you're pregnant, or if you're not cleared to exercise for some reason, then please don't try this last one, at least not yet. And I'll also say it will be best not right after eating or after exercise. So kind of a normal time right when you wake up or before a meal when you're just going about your day breathing. So here's what you're going to do. You're going to have your mouth closed, inhale calmly through your nose, exhale calmly through your nose, and then plug your nose and mouth and hold your breath. What we're looking for is not how long can you hold your breath, but how long can you hold your breath before you feel like you should take another breath. So you can grab a stopwatch for yourself. Again, inhale, exhale, at some point you might feel something in your throat or your abdomen telling you to breathe. That's when you just release your nose and inhale again. If when you do that, it's some dramatic thing like that, then you waited too long. It should be a normal breath because you were just waiting until your normal physiological response told you to breathe, and then you breathed. So nothing crazy should happen. Stop the time, see what it was, send it to me, and let me know if you have any questions.